for the American College of Apothecary faculty meeting. We have a great presenter today, and I appreciate you all attending. And I'm going to do the introduction very quickly because I'll have Michelle give you a little bit about her background. It's Michelle Woolsey, and Michelle, carry on from there.
Okay. Well, hi guys. Thanks for joining me today and taking time out of your busy day to talk about policies and procedures. My name is Michelle. I work for Gates Healthcare and I work with Ernie. I've been with them about 3 years. My background is in lots of different things. So I've done a lot of accreditations. I've done sterile compounding, non-sterile, specialty, home infusion, health systems, retail, just a little myriad of everything. And so policies and procedures is just one of the key aspects that I've always focused on with facilities. And so you'll see that today, talking through the why and the what and how I like to break it down. So we'll get started here. Let's see. Can you see the screen share? I guess, Linda, I need to do the screen share. Let's see. Here we go. Share. All right. Okay, welcome. So today's topic is policies and procedures, what you have versus what you need. And these are inspection tips from the field. So for many years of consulting and what I see, particularly after the recent updates with 797. So our agenda today is just for the purposes of this meeting, how I like to define P&Ps, SOPs, and work instructions. We're going to talk about that very briefly. And then we're going to just give you a little list of general pharmacy policies, administrative policies, and give a few little inspection tips about what I see is missing a lot of times. Then we're going to get into the really nitty-gritty about compounding SOPs and work instructions. And I'm going to give you some inspection tips there on both the non-sterile and the sterile side. And then we're going to kind of wind it up with education and training, the impact of SOPs, and we will talk a little bit about quality and what that looks like there from around a quality program and your SOPs. And then we'll have a little time for some Q&A. So again, for the purposes of how I like to look at these items is what is a policy? So a policy defines a company's rules and their guidelines. It's basically how you manage your facility, the high-level operations. It ensures and outlines compliance with regulatory standards. It can include processes and procedures, but for pharmacies, I call these your general pharmacy policies and/or administrative policies. And then for a standard operating procedure, this is high-level guidance from start to finish for a specific procedure or task. It provides consistency and standardization of the process. It should be customized for the facility, and you utilize SOPs for staff training and assessing competency. Work instructions, in our case, they give all the technical details of the task, and what you're looking for in those is to include in-process checks, verification procedures. You want to define out-of-specification results, how to document, incorporates quality control tasks, and for us, this is master formulations and compounding records. So this is just a list of general pharmacy and administrative policies. I've been in a lot of pharmacies, and they may have these, they may not have these, but this is kind of just what I see typically and what I call general pharmacy policies: code of conduct, your corporate compliance plan, conflict of interest, communication barriers, cultural diversity policies, patient rights and responsibilities, your personnel records and training, how you go about doing that, HR policies, IT policies, workplace reporting, safety, licensing certifications and OIG checks. If you're doing that, that would be an administrative policy. Your controlled substance policies fall under that. Emergency management, patient complaints and grievances can fall under that. That's general. What I would consider, if you're processing any kind of claims, you would have a claim processing policy. I like to see pharmacy operations like a general policy about how your pharmacy operates, HIPAA and medication safety. Just kind of some general ones there. And the tip is inspector tip, administrative policy. What policies? What's commonly missing? Top of my list is a policy management policy. How are you managing your policy? Who approves your policy? Who writes the policy? How do you keep versions of your policy? How do you number your policy? All of that stuff that is very commonly missing. The second thing that is my number 2 is record retention policy. So if you work for a large corporation, perhaps, and they have a corporate policy about records retention, that's great and all for, financial records, their what you consider their HR records and things like that. But it's not always drilled down enough for quality management for our pharmacies. So what you want to look at is any kind of complaint or anything that's a process improvement, quality management, you need to make sure that's addressed because that could be a litigation issue and you want to make sure and keep those. So just take a look at your records retention policy and make sure it addresses your compounding records, your logs, all your stability tests, potency tests, all that stuff. You want that outlined in there and defined how long you wish to keep those. Organizational structure policy. This is a really simple policy. Who's making the decisions? Who owns you? Do you have a board of directors? Do you have a executive committee? Do you have multiple owners? This is usually a requirement of an accreditation to have an organizational structure policy, but it's also a good idea even if you're not. Who does the PIC answer to? Who does your DP answer to? Kind of just organizational structure. I find it to be very helpful.
Michelle, your
Yeah.
slides aren't changing.
Oh, I'm just going through the list
Oh,
here.
okay.
Can you see the list, the organizational structure? Can you see it?
No, no, it just says policy and procedures, what you have versus what you need.
Oh, they're not changing?
No,
Oh, you don't see them? Okay, hold on.
whether the work instructions is showing up now.
Okay. Did you see
General
these?
pharmacy, yep.
Okay, well, we'll just work off this one. I'm actually on this slide. Can you see that?
Yes,
Okay, I'm so sorry. Thanks for letting me know. So just a recap here, policy management policy, records retention policy, org structure policy. This is a critical one, distribution of company information. I rarely see this one, but I highly recommend it because as compounders, what you're doing is unique and owned by your pharmacy. Your formulations, how you make things, how you flavor things, your stability, all that stuff is unique to your pharmacy. It is your work. And so I know that you have like confidentiality agreements. This is not the same thing. This type of policy will, they cannot leave with the formulas. You own these formulas. If you have any patents on any formulas, company information, distribution of that is very important, particularly if you have employees that leave. DSCSA vendor policy, I have an asterisk by this one because this is another one that I see commonly missing. I know with compounding pharmacies, APIs are excluded from, there's a common knowledge, oh, well, it's exempt. We're exempt from DSCSA. You're not exempt from DSCSA. And where that specifically points to is vendor verification. So you should have a vendor policy or within the vendor policy and or DSCSA policy, you should address vendor verification validation, making sure that you have a spreadsheet or a checklist of how that is being done and to back that up. Also, suspect or illegitimate products is part of that DSCSA. Make sure you check and see if you have one of those. And then complaint policy, and this is specific for like recalls and make sure your complaint policy has like when you're going to do a recall on a product, particularly for that. And then the last one that we'll talk about in later detail is quality management and KPIs. And we'll talk about that in a later slide. Last but not least, on here for administrative policies, medication rescue policy. So this is missing quite a bit as well. It's really part of your emergency plan. But what I don't see, I see a lot of tornadoes. I see a lot of electrical outage and all that stuff. But what I see missing from that is your medication rescue policy. So if you have multiple refrigerators, if you have multiple freezers, if you have finished product refrigerators, and the electric were to go out, where would you move that? Where would you move your product if your building was not able to be secured? If the electric was not going to come on within, the 4 hours or the short window of time. Medication rescue policy is important. It's important to walk through that with your emergency management team. Facility safety and security. This isn't a requirement by any means, but this is, I think, really easy to write for most pharmacies. Facility safety and security. Who has access to your pharmacy? What are your hours of operation? Who has access to it after hours? Your cameras, your security around your controlled substances, if you have that. Drivers get in and out, that type of thing. So that's a general basic one. Medication errors and reporting. So for compounding pharmacies, we see a lot of out of specification. I see a lot of out of specification SOPs. It's out of spec, what do? You instigate you look into it, figure it out. But actual medication errors and reporting, what are you going to do when a patient reports? What if something went out? Make sure you have a good policy on that is actually accurate to what you're doing. Medication shipping and packaging, these two go hand in hand. So I'm willing to bet almost everyone on this call is shipping cold chain pharmaceuticals out your door. And this policy indicates the temperature requirements around a room temperature package, temperature requirements around your refrigerated package, and the type of supplies and items that you're using to do that, to maintain product integrity. It also talks about medication shipping, what happens if you lose a package, if there's a mishap with the package, if there's a damage to the package. It really outlines how you're handling all that. And also if there's a HIPAA breach, if there's an error and it goes to the wrong person, how do you all handle that? And then the packaging medications is really like your pack out. So a lot of people do pack outs. They'll have a pack out. They've either they have a contract with a company that provides them the coolers, the sleeves, the whatnot. But what I don't really see a lot of is a packaging medication SOP that has that validation or that pack out in the SOP or the policy, and how often you're doing validation testing. As you know, if you're going to send something to Arizona, most of the time it's super hot. If you're sending something room temperature to Arizona, have you done a validation test on that and what those parameters would be around that? Marketing policy. This is not a requirement to have, but as you all know, you can get into a lot of trouble marketing compounded products on your website and on the internet, wherever you're using to market. This is a marketing policy that outlines those parameters and that indicates for your company that you're not, making claims about compounded products against FDA regulations. This last one is kind of a new one. It's a hot topic in our compounding pharmacy world right now, is white bagging. So I was at a pharmacy a few weeks ago, and they were making semaglutide, and they were shipping it to the provider's office. Well, when you do this, this can make you look like a 503B, right? So your white bagging policy really should include how are you all acknowledging that the provider is receiving that, and what type of documentation are you getting? Is the patient signing for the product when the provider gives it to you? Do you have a packing slip or something that needs to be scanned back to you? That type of thing. So what is your process there? Are they getting HIPAA notification? Is that in that new patients? And another thing too there is making sure if you are shipping to providers' offices some of these medications, that you have the allergies, that you've got the full thing on the patient, their drug lists and everything. So you typically see a white bagging policy in a health system, right? They're taking it up to the provider's office on the 4th floor for administration, but I'm starting to see that a lot with some of our weight loss drugs. So make sure you have a policy on that, because if the FDA shows up, you're going to want to be able to show them how you are maintaining integrity and being patient specific with your compounded product. All right, into more of our favorite topic is compounding SOPs. These need to be customized for the pharmacy's procedures. That's a no-brainer. But I'm just going to give you some high level areas to focus. So many people will buy, they'll buy policies from a company. You'll get it from Fagron, Medisca. They have great policies. They're beautiful, and they put them in a binder. And when your inspector comes in, or surveyor, or the FDA comes in, they say, "Do you have a policy for that? Show me the policy." And you're like, "Oh, it's right here. Let me see what page it's on." And it has never been customized. And so, yes, it might meet the standard, but it isn't how your pharmacy functions. So areas of customization, focus areas, if you're going to focus your time on taking something that you've purchased and making it customizable, here are the areas that I highly recommend. Training and competencies. How do you train? So many times this is verbalized to me, but it's not outlined in a procedure or a process. So training could be didactic training is completed by when, they sign off on this, and then they do SOP training that they do. How many times do they do observations? Who signs a competency, or they assign? So making sure that your training and competency SOP really is very detailed and shows that. Also on your competency, you want to be doing initial, you want to be doing annual, and I highly recommend doing random competency testing. This is part of quality management. And so please look at that and consider that. Hand hygiene and garbing. It's really easy to buy a policy that talks about hand hygiene and garbing. Just make sure that your SOP matches what it is you do, because you might have a bench in your clean room that they're going to sit on. You might have a bunny suit that you're using, and the policy might just talk about the gown. You might use a full hoodie. However it is you use it, make sure that that policy is specific. Cleaning, one area that I always see missing is general pharmacy. So your general pharmacy, your front areas, how are you cleaning with that? Are you doing some infection control, regular disinfectant? Do you have a contracted company coming in? So I break down cleaning into 4 areas: general pharmacy area. And for some facilities, your non-sterile compounding area might be next to where you're making, liquids or suspensions. It might be right next to your general pharmacy area. You might not have where you're going in a room and doing that, or an isolated space. And in that case, this is why, your general pharmacy disinfection, what are you doing, is important for those particular facilities. Non-sterile compounding areas, what are you using in that? Sterile compounding labs, and then your hazardous. So how I've always done it in the past is I like to break down these into different cleaning processes, because you can take the SOP and you can use it as a competency in each area. It's very difficult for technicians to have some big, long, huge cleaning SOP and to really use it as a working document for them to learn from. So it's not wrong to have it all in one, but just make sure, I would recommend kind of separating it out in your SOP. Here's non-sterile, here's hazardous, here's general. Formulations, this is a huge one that I see missing all the time. SOPs on each of your formulations is very, very important. You can, again, if you purchase these, they're going to be pretty cookie cutter, but if you're using a pro filler or you're using a different type of, you need to walk through your SOP to make sure it matches what you're doing. And we'll talk about how to get that done here in a little bit. Equipment SOPs, almost always missing. What you commonly see are SOPs around primary engineering controls, secondary engineering controls, of course, but I have yet to see one about your repeater pump and how did you train the technician on your repeater pump? How did you train the technician to use the hot plate with a stir, and how to remove the stir, or when to remove the stir, pH meters, how to use those. So you should have an SOP on each piece of equipment that you have, and then have a corresponding competency. And we'll go into a little bit more detail about that in just a minute. But these are typically formulations and equipment, huge gaps in SOPs across the board. Quality control and in-process checks. So this is something I really do drill down on. I will pull master formulation records and your compounding records, and I want to see quality control, distinct quality control aspects in all of your different formulations and how that's being done. And where did you do an in-process check? Was and so that should be built in there. And I saw this constantly missing. And it's not necessarily always missing, it's just it could be a little bit better, paid a little bit more attention to. And then out of specification reporting, again, I've seen so many pharmacies, they have a policy on it, they know what it means, it's a term you use, but are you really using the SOP to follow the procedure and really doing it? So. All right, non-sterile compounding, inspector tip, what's commonly missing? Can you all see this? Good, okay. And we talked about this. Formulation SOPs, equipment SOPs. Occasionally I see beyond use dating of compounded preparation, the beyond use dating SOP missing, and that or not updated with the recent 797. So make sure you have that. This is an interesting one. It's kind of customizable, but non-sterile compounding process validation. So how do you know that, that technician accurately compounded a capsule? How do you know that they actually accurately did a tablet? How are you doing that initial and ongoing? And that is really part of quality management. And so making sure that that is really defined in your SOPs. How are you checking to make sure that the capsules that they're making, are you doing random checks? And we'll talk about internal audits in a second, but that's what that links to. Non-sterile compounded finished preparation testing. What is it that you're sending out? Make sure you have an SOP on what that is, what lab you use. Are you holding product before it comes back? Are you releasing it? What are you doing? And then again, hand hygiene and garbing requirements that usually needs to be customized, and it's not. The other thing I see missing is formulation competencies. So if you have how to make a capsule, I see missing many times the formulation competency on how to make a capsule. So did they walk through and make a capsule for you? And it should align with the SOP. And it's a pretty easy mix, but like how to make a tablet, what do you weigh? You use your SOP to build the competency, and you do that the same thing for equipment. Master formulation and compounding records. I've mentioned this here because what I find, again, this is inspector tips. Within your SOP, within the SOP of master formulations, number one, where did you get the master formulation from? How are you documenting where that came from? Who was the owner of that? And then if you review it or edit it or modify it, do you have a second reviewer of that? Is that outlined? And you should be keeping each version. What version is it? So most pharmacies, compounding pharmacies, yes, they have a policy on this. It's kind of a no-brainer. You have to have it. What's included in a master formulation. But what I see is the control of that. Where did it come from? How are you referencing that in your compounding program in there? Where did it come from? So something to take a look at. And again, we talked about cleaning procedures in the non-sterile compounding area and the general pharmacy cleaning procedures. Now moving on into inspector tips for sterile compounding. What do I see commonly missing? Again, kind of the same thing. Formulation SOPs. So I went to a pharmacy not too long ago. They were making autologous eye drops. They did not have an SOP on how to really compound an autologous eye drop. And so therefore, how do you demonstrate competency if you don't have a document or a training teaching document? So another inspector's tip here is doing observation and having them be taught by a random technician or the technician you assign. It's not enough. You really need to make sure that they're trained on the formulation and how to make what it is that they're making. Equipment as well. Commonly you see PEC training. They've done that online. They've done that didactic. They've seen that, but really that any repeater pump, any equipment that they use, you should have an SOP for and a competency for. This is also at the top of my list with some of the more recent changes, as you all might be aware. The designated person became a front and center person with some of the recent changes last November. And what I'm not seeing is that this is pulled out as a separate policy to outline who is doing what and what they're responsible for. So I highly recommend, and what I have found is that it's usually, for example, in a sterile compounding, the designated person is responsible for XYZ, and it's in this policy over here, and it might be in the, I mean, SOP, and it might be over here in this SOP under non-sterile. It might be a little bit everywhere, but if you were to walk in and say, who is doing what and what is their responsibility, that's really important. I highly recommend pulling that out and putting that in an individual SOP. This is particularly helpful if you have multiple people doing different roles. If you've got one doing sterile, one doing non-sterile, if you have a hazardous drug designated person, what they're doing. And then this also can relate back to their performance metrics and their job description. So it would be really easy if you all have assigned someone to be a designated person as part of their addendum or their job addendum to take this and pull this out of the SOP and have them sign off on that when you do their annual evaluation with them. That is just performance management. So recommendation there. HD assessment of risk, I see missing a lot. I see a lot of lists. But for example, I walked in somewhere and it was a liquid. They were doing a liquid HD and they had done an assessment of risk and the person didn't need to wear a mask. So, but that is supposed to be posted and readily available. Make sure you have done that for all of your new incoming products that you're assessing it. Does it need a mask, full gear, all that stuff. And then the other tip from here, from sterile compounding, medication guides, this probably isn't sterile, but medication guides are missing in a lot of the compounded estrogens. That was late last night when I put that on there, so that's usually non-sterile. But any compounded estrogen is required to have a medication guide, and unfortunately, these aren't something you can download. You have to really write them yourself with your formulations, whether that's triest, biased. And a lot of pharmacies will just do they'll do an estriol, they'll do an estradiol, they'll do one separate, and kind of depending on the formulation, they'll put all those together. So definitely don't want to be missing those. The two formulation companies I see most commonly missing are capsules and tablets. The two most common equipment competencies that I find missing are for the autoclave and depyrogenation. If you have a bender oven, training your employees on that. What is the test? Using the endotoxin test, making sure that they feel comfortable doing that, whether that's a pharmacist or a technician doing that. And you can use the manuals of these things to help build your SOP, but it also needs to be a little customized for what you're using. Receipt of bulk chemicals. One area of the SOP I find missing is the C of A review process. So one of the questions I always ask is, what do you do with your C of A's? Who's reviewing them? What happens if they're out of spec? What do you do? And a lot of people fumble on that. So even if you're uploading them, that's wonderful, but who's reviewing them? Is there a signature on them? And who is responsible receiving pharmacy? Who is responsible for letting someone know that the API came in wasn't correct? C of A's also of your filters, items like that, your equipment, you also need to keep, and that needs to be part of the documents you keep. Something that I also see, last but not least, under sterile is clean room certification. So you will not find, rarely have I ever found an SOP on clean room certification. It's usually environmental monitoring, environmental management, facility, but I would highly encourage you to write an SOP on clean room certification and include these three things. You should require your team to have a certification day checklist. So often across the country, I've seen certifiers come in, there's no one with them. They use themselves as the one person in the room, and they don't do any kind of checkout with the PIC or anybody if there is anything wrong. They don't discuss smoke studies with you. They go in, they get out, maybe they have another job to go to. There's not that checkout or that oversight of that person. How do you know how they were trained? Watching them garb. When your certifiers come in, they could be introducing, things into your clean room. So you should definitely have someone with them. They shouldn't be counting themselves. Conditions of the certification as well. If you were to write a policy about this, which I might do as soon as we get off the phone, is the conditions of the certification, making sure what does dynamic conditions mean to your pharmacy? It means that the certifier does not count themselves. It means that if you have 3 people in the room without the certifier, then your room is certified for 3 people. So I saw one the other day where it said dynamic conditions. There was one person in the room. Come to find out, the certifier had counted himself as the one person in the room, and it was that was dynamic conditions. That's not dynamic conditions. So make sure in your SOP that you write this out as to what your expectations are for environmental monitoring on the day of your certification. Last but not least, another thing I commonly see is no video of smoke testing and no witnesses. So they video it to you, or I've seen some of them do it on their phone and then they send it to you later. But your certification day checklist and you should have a discussion of that. In addition to that, you should have your team simulating compounding in your hoods for the DCA areas. So that's just something for thought there to build. Making sure we're on time here. So the other thing here is creams, gels, ointments. Here's all the different formulations. I'm sure there's a lot more, but if you have allergenic extracts and you're doing that, you need an SOP for that. Suppositories, many of these things are, if you've bought a packet of policies, they're there. Just take them and make them specific. How I did it when I was in the pharmacy is you can utilize your team to help you do that. We'll talk about that real quick here. Here's all your equipment: analytical balance or an L-house balance, primary engineering controls, reverse pressure pump, your pH meter, capsule machine, tablet press, ointment mills, unguentator, mixer. This should be at least as the minimum, if you have any of these and all of these, this should be in your SOP equipment list. So training and education, kind of talking about tracking revisions. You are required to keep all revisions of your policies. So you need to keep those on file. I know it's so easy. I've done it myself where you're working on something and then you save over on top of it. But you do need to have document control, and that's under your policy management policy, that you have to keep the original, and then maybe you make a duplicate and you work on version 2 or version 3. But you are required to keep that, all the versions of the policy. Policy review and acknowledgements. This is kind of a debate between, you have a training binder, and a lot of people do. They have a training binder, and that's wonderful and it's great and it's easy. But what this also needs to be attached to the employees' a competency, and they need to be given copies. If you have HR file, they need to be associated with the individual person, because that's about performance management and competencies. Where this would come back and be viable is if something were to happen, there would be error, there would be patient harm. You're going to want to go back to that technician's file, the pharmacist file, and you're going to want to have to pull those competencies. So just make sure as a thought that you keep those together. And I highly recommend you to utilize an online format if you can. I know that's difficult, but it's so much easier to push out. If you needed to update a policy for a regulation change, you're just able to push it out, and you're able to get employee acknowledgement of that instead of I've seen some pharmacies, they just keep a binder in their break room, and the front of the thing, they go in there and people sign it and they really haven't read it. So, I don't encourage that type of process, but standard operating procedures, work with your team on customization. I had a client that bought a tablet press and worked on it a lot himself, and probably came up with a formulation on how to do it and the operation procedures on how to do it. Then, what I've done in the past is I get in there and just write it out. You write out what you're doing, step 1, step 2, step 3, and you can have your team do this. You can have your technicians do that. You meet with a few other people. Is this accurate? And there it is. Boom, there's your SOP on that. And then all you do is you turn around, you create a corresponding competency. Number 1, step 2, step 3, you know how to make a tablet or a capsule. And that's really important for capsules, because those capsule machines, it's kind of an art on how to use all those. So you want competency. Conduct your competency training on an annual basis. I know this is like a big corporate type of thing, but I highly encourage you to do annual competency on all of your equipment and your formulations. And again, retain this in the employee's file as performance management indicators. All right, last but not least, few minutes, we're going to talk about quality management and process improvement. And this is something that you all know very well. But I was going to make a recommendation to everyone today, and I've been working with a couple of my clients on this. Quality management for our compounding facilities and many of your SOPs, it's embedded throughout many different areas. You might have a quality control procedure over here on a capsule. You might have quality control over there on a sterile, and it's going out and you're doing sterility testing, and your quality management, it's all over the place, and it's very difficult for sometimes the pick to say, here is my quality management program. And so here is all the things that we test. So I highly encourage you to build a program and a policy or a procedure that talks about all the stuff that you're tracking. And then we're going to talk about next, what are you going to do with that? Training and competency. So you want to audit your files. That would be kind of part of your quality management program. You want to audit your files quarterly, make sure all your trainings and competencies are up to date. You want to talk about all the things you're doing for quality management around sterile, outline it under sterile, non-sterile. You're sending out things for potency. Are you doing any kind of random checks or utilizing internal audits for the data? Equipment, facility management, in-process quality controls, finished preparation validation, out of specifications, med errors or shipping errors. You should be tracking those. Patient complaints, adverse event, and vendor validation is part of quality management, making sure that the APIs that you're getting are from validated vendors, and that the C of A's have been reviewed. So those are just some things I highly encourage you to think about putting that all in one policy so that you can see it. And then for your process improvement policy and or your CAPA policy, the number one thing that I see missing across the board is defining thresholds. So if you send out a test for sterility and you sent out 15 of them in the last quarter, your threshold or your baseline expectation is you want you want 0 failed results, right? Everything that you sent out, you want it to be sterile. That is your goal. That is the threshold. If it is anything above that, you want to do an initiation. So this is the one area that I see in these policies, because they are very cookie cutter at times. Not a lot of what is it that we're doing. If you have failed capsules, if you have tablets and it failed, what is those thresholds, and creating a scorecard. Under process improvement, you also want to do internal audits, document. Absolutely make sure you're validating changes or new processes under your process improvement. Validate it, make sure it works, and then also make sure you're following up in a month, quarter, to make sure that's effective. And then that would be the end of the CAPA. And last but not least, my last recommendation is create a quality scorecard. How can you demonstrate, what you guys are doing, and track it? Conduct internal audits, monthly, quarterly, doesn't matter. You want to be doing around internal audits. You want to be checking your logs, refrigeration logs, your cleaning logs, anything like that. And from that, what you're doing, random testing, you're going to find that there's going to be areas that you can do process improvement from, and you're documenting that. Track and trend your data. I don't see this anywhere where we sent out 10 stability test potency. It all came back. This is powerful information about the quality and the potency and the sterility of the products that your pharmacy is sending out, and keeping it all in one place and tracking and trending it is really important. And then annual quality report. I see this missing all the time. It is not a requirement, but every year you should look at everything that you did, have a review of your CAPAs and process improvement, and that should be a formalized meeting with meeting minutes and documentation of who was there. So those are things that I see missing, kind of, and it's time for questions.
Michelle, can I just ask you to elaborate on a real world inspection of what you find? You've done, so many of these inspections for out of state. What's the typical problems that you find the most?
Well, just to kind of reiterate, quality management, talking particularly that this is really an update from 797. You have to have a quality program. What I'm seeing is missing is everybody really getting a grasp on all the different things that they're doing and having it in like one policy or procedure or one program that they're not meeting on it regularly. If the sterility test comes back and it's good, they put it in a binder and they keep going. So really, I see an opportunity for compounding pharmacies to really step up our game around quality program management and really start to develop this program within your facilities. That's a big one, Ernie. A lot of discussion on that one.
Let's see. So I'm checking the questions. Hold on a minute. Okay. Looking in the chat, nothing yet. Jeez.
Oh,
Well,
good. No questions. That's
these are
great.
all, everybody's got home runs.
That's
But
great.
again, I want to thank all of you folks for joining this policy and procedure presentation by Michelle. The experience level that she has written hundreds and hundreds of policies over the years. She's been doing a great job, helping pharmacies out of the problems, because now it's with all these inspections going on, covering from all kinds of areas, that from FDA to the 503Bs, 503As, the 800 is a big consequence for a lot of pharmacies. But it was great, and we really appreciate you, Michelle, for
Thank you.
donating your time to do this presentation. And
I hope
again,
it was
thank you
valuable
all.
to everybody.
Linda, do we have anything else that we need to say?
Short and sweet.
No, that's all I have.
All right.
Okay.
So,
Thank you, everyone. Thank you for your
Great.
time.
Have a safe day,
thank you,
guys.
everyone.
Thank
Great.
you.
Thanks for joining. Bye-bye.